A stomach virus, also known as viral gastroenteritis, is an infection that affects the stomach and intestines, causing symptoms such as nausea, vomiting, diarrhea, stomach cramps, and sometimes fever. It is often referred to as the stomach flu, although it is not caused by the influenza virus. Instead, stomach viruses are typically caused by several different types of viruses, with norovirus and rotavirus being the most common. Causes of stomach virus. A stomach virus occurs when a person becomes infected with a virus that attacks the digestive system. The most common viruses responsible include norovirus, the leading cause of viral gastroenteritis worldwide, highly contagious, spreads through contaminated food, water, and surfaces, and can cause outbreaks in places like schools, cruise ships, and nursing homes. Rotavirus, more common in young children and infants, primarily spreads through contact with infected fecal matter and can cause severe dehydration if not treated. Adenovirus and astrovirus. Less common but can also cause stomach infections, particularly in children and people with weakened immune systems. Symptoms of a stomach virus. Symptoms of a stomach virus usually develop within 12 to 48 hours after exposure and can last from 1 to 3 days, though some cases may last longer. Common symptoms include nausea and vomiting. The body tries to expel the virus by inducing vomiting. Diarrhea. Loose, watery stools are common and can lead to dehydration. Stomach cramps and pain. The intestines become inflamed, causing discomfort. Fever and chills. A mild fever may occur as the body fights off the infection. Headache and body aches. Some people experience fatigue and muscle pain. Loss of appetite due to nausea and stomach discomfort. Treatment and recovery. There is no specific cure for a stomach virus, as antibiotics do not work against viruses. The best treatment focuses on managing symptoms and preventing dehydration. Stay hydrated. Drink plenty of fluids such as water, electrolyte solutions, or broth. Avoid sugary drinks and caffeine, as they can worsen dehydration. For severe dehydration, oral rehydration solutions like Pedialyte may help. Eat bland foods. Start with simple foods like toast, rice, bananas, and applesauce, known as the brat diet. Avoid dairy, spicy foods, fatty foods, and alcohol until symptoms improve. Get plenty of rest. Allow the body time to fight off the virus by getting enough sleep and avoiding strenuous activity. Over-the-counter medications, if needed. Pain relievers like acetaminophen, Tylenol, can help with fever and aches. Anti-nausea medications may be recommended by a doctor in severe cases. Avoid antidiarrheal medications like loperamide, Imodium, unless advised by a doctor, as they may prolong the infection. Final thoughts. A stomach virus is an unpleasant but common illness that usually resolves on its own within a few days. While there is no specific treatment, staying hydrated, eating mild foods, and resting can help speed up recovery. Good hygiene practices, such as frequent hand washing and proper food handling, are the best ways to prevent the spread of stomach viruses. Recognizing the symptoms early and taking steps to avoid dehydration can help reduce the severity of the illness and promote faster healing.